Hello everyone. Our topic of discussion is identification of clinical stimulators. These are the muscle stimulators or neuromuscular electrical stimulation equipments used in electrotherapy, which is a branch of physiotherapy. First is galvanic stimulators. These type of stimulators, they deliver continuous direct current. The current flow is unidirectional. It can be reversed or interrupted or surged. However, whenever these modulations are done, for each pulse, the duration of pulse is 1 second or longer. The physiologic response to this type of stimulation can be classified into chemical response and excitatory response. As the current passes through the body tissues, there is an electron-ion interchange and chemical process which occurs, which results into alteration of pH, and that may also result into chemical irritation and reflex dilatation of the surrounding tissue, which may result into localized erythema. The current may also stimulate the neuromuscular tissue and may result into excitatory response. The response is localized to superficial tissues only, and the superficial subcutaneous nerve fibers may undergo stimulation. If the stimulation is mild, the person who is getting the current may feel mild tickling or prickling type of sensations. If the intensity is strong enough, the person may have painful or burning like sensations. If the intensity is strong enough and the duration is long enough, the galvanic stimulation may elicit a muscle contraction. The denervated muscle fibers are more easily excitable under the effect of galvanic stimulation. The usual response in this type of stimulation of muscle contraction is twitch type muscle contraction, that is sudden muscle contraction followed by sudden relaxation. Faradic current is current produced by the Faradic coil used by Faraday. It has been in clinical use to stimulate the muscles since late 19th century. The pulse of current produced with the Faradic coil is an asymmetric pulse. The pulse duration is shorter than the galvanic current. The duration on an average is about 1 millisecond. The frequency of this current is 1 to 50 or 60 pulses per second, and each subsequent pulse intensity may be progressively increasing or decreasing, and the process of this ramping up and down intensity is known as surging of the current, and that's why many times such stimulators are known as surge Faradic stimulators. On the left side graph, you can see a typical pulse produced by the Faradic coil, and as you can see, the first wave, which is having a very rapidly rising pulse with a very sharp peak, and it is the peculiarity of this sudden rising impulse which results into stimulation of motor nerves and production of muscle contraction. The modern stimulators modify this pulse, and they have made a sudden rising, very short duration rectangular pulse, and that's why this monophasic pulse producing instruments are known as Faradic type stimulators. Surging of the current in Faradic type stimulation, it produces a near normal tetanic like contraction as compared to the twitch-like contraction which is produced in the galvanic type stimulators. And the circuit can be modified to give different modulations in the format of duration modulation, frequency modulation, and waveform modulation in the surge Faradic stimulation. So in this slide you can see the different modulations of Faradic type current. The first one on the up shows a continuous series of 1 millisecond pulses. You can see the gaps in between them. The second one, there is a progressive increase in the intensity of subsequent pulses followed by a sudden drop, rest interval, and again a second burst of these surged pulses. So there is an intensity modulation. In the third one, you can see that surge time is longer, so the intensity increases to the peak slowly, but the duration of burst is longer, whereas in the subsequent burst there is a relatively rapid rise in the intensity and the duration of pulse is shorter. In the next one, you can see the interval between these three pulses is larger as compared to the group of bursts shown in the side. The interval between the surge is less. And in the last image you can see that the one is a triangle, right angle triangle, and when such multiple right angle triangle bursts are coming in a series, it appears like a sawtooth. So this is known as sawtooth pulse. The next one is a triangular pulse, and the next one is a trapezoidal pulse. In the trapezoidal pulse, there is progressive rise in the intensity. The peak intensity remains continuous for a certain number of pulses, followed by surging down, so that the intensity becomes 0. In triangular pulse, there is slow rise and immediately followed by slow drop in the consequent pulses intensity. Diadynamic currents are another group of stimulation type. The currents are monophasic pulsatile currents. They are produced from rectification of the sine wave currents. So 50 Hz or 60 Hz sine wave current, alternating current, when it is rectified, fully rectified, it will produce 100 monophasic pulses if it is a 50 Hz basic sinusoidal current. If it is a 60 Hz current, it will produce 120 monophasic pulses. So right now we will consider the 50 Hz sinusoidal current, and each single pulse will be a 10 millisecond pulse that is rectified, and the current will be passing in one direction, so we can say it is unidirectional current. So with half wave rectification, there will be 50 pulses per second, 10 millisecond pulse followed by 10 millisecond interpulse interval. If it is full wave rectification, there will be 100 pulses per second and there will not be any interpulse interval. The current is used for the excitatory response. The duration is longer slightly, and because it is unidirectional, there may be some chemical changes occurring at the electrode skin interface, and the current might feel uncomfortable to certain people. Monophase fixe is one variant of a diadynamic current. In short, it is known as MF, and you can see in the image that it is appearing as only one-sided alternating current in the sinusoidal waveform. So the opposite side waveforms are nullified because it is a half-wave rectified current, and here we are able to see 10 millisecond pulses or fixed duration pulses of this alternating current. The second version of diadynamic current is Diaphase fixe, in short DF. And here you can see, as compared to the monophase fixe where there was interpulse interval present, here the opposite side sine wave, half sine wave, is reversed due to rectification and has appeared on the same side. So there is no interpulse interval and each pulse is of the same duration. The alternate application of MF followed by DF followed by MF followed by DF types of diadynamic currents forms a new format of diadynamic currents, which is known as CP module. Another type of diadynamic currents is LP module, where two MF versions of diadynamic currents are coming subsequently. So one MF version has a sustained intensity and another MF, which is the pulses are coming in the interval phases of the first MF. They have progressively increasing and decreasing intensities. Next type of electrical stimulation is TENS. TENS is a short form. Full form is transcutaneous electrical nerve stimulation. By simple definition of TENS, one can say that any type of current which is applied through the skin and which produces nerve stimulation can be defined as TENS. So in that way, all the currents that stimulate the nerve can be said to be as TENS. But clinically and in routine practice, the small instruments which are battery powered and patients can also operate them by themselves, and their primary purpose is pain modulation or relief of pain. So this type of small handheld battery operated devices used only for the pain management are clinically defined as TENS modalities. Most of TENS modalities offer monophasic, biphasic or polyphasic pulses. The frequency of these pulses is adjustable in the range of 1 Hz to 120 Hz, in which they can stimulate the sensory as well as motor peripheral nerves. The units are mainly used for relief of pain, and the shape of pulses used for this purpose are rectangular pulses, mostly biphasic pulses, and the pulse duration can also be adjusted in a range of 50 to 200 microseconds. As you can see, the duration of each pulse is very less in the microsecond ranges. The mechanism on which this modalities induce pain relief, it is based on the pain gate theory, which is given by Wall and Melzek. Next type of stimulation is interferential current, and here there is an actual interference between two medium frequency currents. So this system utilizes two sinusoidal current forms, and these currents differ in their output, so that both the waves are slightly different in frequency, so that they do not match their peaks and troughs at the same time throughout the series. So sometimes the peaks merge and have an addition effect. Sometimes the peaks and troughs match and have a cancellation effect, and the system is made in such a nice way that whenever this interference occurs between these two currents, they produce a typical envelope shaped waveform with progressively increasing and decreasing intensity. The original frequency of this interferential current channels, we call them the carrier frequency, is within the medium frequency range, usually 4 kilohertz, sometimes 2 kilohertz. And when these frequencies are interfered, they produce this progressively increasing and decreasing pulses. These are also known as beats or envelopes, and these beats are produced at a lower frequency, again within the range of 1 to 120 Hz, which can be determined by the difference of the original two intensities and their frequencies. So this interference producing the beats will actually produce the low frequency beat current, and that is useful for stimulation of peripheral nerves. So as you can see in this slide, that one channel shown as the blue color and another is shown in the red color. So these two channels, when the currents are given through both the channels in such a way that the currents interfere with each other's frequency. So in the initial phase, as you can see, peak of blue and red, they are having an additive effect, and somewhere in the middle they are having the cancellation effect. So progressively the frequencies are decreasing, again they increase, again they decrease, and in the middle, as you can see, there is an envelope or pocket has made. So this is known as beat. So the beat is repeated at a relatively lower frequency as compared to the original two carrier medium frequency currents. So here the beat or envelope is highlighted under the black borders. So as you can see in this beat, that each wave, sinusoidal wave, is progressively increasing in intensity and then progressively decreasing in intensity, and it is the middle part of the wave where the peak intensities are present, and these intensities are actually responsible for producing the peripheral nerve stimulation. So the interferential current involves the two medium frequency currents of around 4000 Hz or 4 kilohertz. The benefit of medium frequency range is it reduces the skin impedance, and the currents are much more comfortable to the patient, and the penetration is better. So maximum total current can reach about 70 to 90 milliamperes, and the additive effect of interference inside the tissues is much more stronger as compared to the direct low frequency stimulation given to the skin, because they are more uncomfortable. So primary use of IFT or interferential current is pain management, reduction of joint effusion, and inhibition of muscle spasm. As the beats are coming continuously and the instruments provide no option for on time and off time, so this system is not particularly useful for re-education of muscles. Next type of current is Russian current. It is named as Russian because it was invented by Dr. Kotz, who was from Russia, and when it was first used, its benefits has been claimed to give benefit to the participants in the Olympics in around 1970, and Russia won most of the gold medals or major number of gold medals, and that's why from that time the current has gained the popularity that these currents can be used to strengthen the muscles. So because its primary intention is muscle contraction, they are used or indicated for muscle re-education and muscle strengthening. So these are continuous sine wave outputs of 2500 Hz, and they are modulated with on-off time in such a way that they give 50 bursts of pulses in a second. As you can see in the diagram, the horizontal line is timeline, x-axis, y-axis shows the voltage, and the sinusoidal wave bursts can be seen. The duration of wave burst is 10 millisecond followed by 10 millisecond rest. So a single on-off cycle covers the total 20 milliseconds, and 20 multiplied by 50, that covers 1000 millisecond equal to 1 second. That's why the currents are 50 Hertz frequency current with 10 milliseconds on and 10 milliseconds off time. Next type of stimulation is high voltage stimulation. They are also known as high voltage pulsed stimulation or high voltage pulsed galvanic stimulation. The current uses twin peak pulse, which is the typical characteristic of this current. Each pulse duration is very small, in the range of 5 to 65 microseconds. They have very high peak current intensity in the range of 2000 to 2500 milliamperes, and the interpulse interval is very long. As the intensity is very high, it is usually they keep the interpulse interval relatively prolonged. The primary indications of the high voltage stimulations are pain management, reduction of joint effusion, reduction of muscle spasm, to enhance the dermal and subdermal tissue regeneration. It may be used for muscle reeducation, and it may improve the venous blood circulation. As you can see in the images, there are two versions of high voltage pulse stimulation. On the left side, it can be seen that the twin peaks are present, but they are having enough interval between them. So there is a sudden rise followed by gradual decline, and after around 65 microseconds, the second peak comes, and followed by again gradual decline, and around 65 into 2, that is 130 microseconds, the pulse is over, followed by the complete rest for a very long time. So this is one example, and average effective pulse duration is 65 microseconds, and for each peak, the peak intensity usually remains for around 7 microseconds, which is the effective time. In the second version, on the right side, you can see that as the intensity reaches peak and drops down within 7 microseconds to half, again the second peak comes, followed by gradual decline for again 7 microseconds. So total effective duration is 14 microseconds, followed by gradual decline in intensity up to 100 microseconds, followed by long interpulse interval. So it is the overlapping twin spike which reinforce the effect of pulse, and this effective pulse duration is around 14 microseconds, which produces a strong motor response. The next stimulation type is microcurrents. They are known as microcurrents because the current intensity is very low, within the range of certain microamperes. In the routine clinical stimulation such as galvanic or Faradic or Russian or interferential or other types, the current outputs are high, within the range of maybe as high as 80 to 100 milliamperes. In microcurrent, the current output is less than 1 milliamperes. The pulses of current may be monophasic or biphasic. The frequency ranges up to 10 Hz and have a duty cycle of about 50%. The next and final type of electrical stimulation is REBOX type current. The REBOX is a device which was developed in Czechoslovakia in 1970s. It has a handheld dispersive. The current is delivered by a point type electrode. The point electrode is a negative pole. The current consists of a unipolar rectangular pulses ranging between the 50 microseconds and 250 microseconds. The frequency of the current is 3000 Hz. The device has a setup in which there is a micro emitter connected, and the earphone is also connected. So the therapist who is applying the current can see the response at the micro emitter and have an auditory feedback through the earphone. The system may also be connected through the computer to a display where a current graph can be seen and even other parameter output can be seen. The device is primarily utilized to find out the response of tissues to the current, and as there is a healing response or outcome is seen, the waveform of current and the sound quality changes, which are providing the feedback to the therapist. So that's all for this presentation. Thank you.